Phases of digestion. 3 phases. Cephalic, starting with the head. So the brain involvement. And this is primarily anticipation. And there's grandma baking bread, pulling it out of the oven, and you smell the bread, and if you're at all hungry, your stomach begins to rumble, maybe you start salivating. The cephalic phase of digestion is getting involved and preparing the rest of the system for bread or whatever, for a meal, to begin digestion. So it starts the stomach rumbling, starts acid production, etc. This is the brain involvement, so parasympathetic nervous system and the vagus nerve, cranial nerve 10, which innervates the stomach, smooth muscle, digestive glands, etc. And you probably remember or been exposed to the story of Pavlov's dogs, which is an example of classic conditioning. And it's a sort of feed-forward control. So here's the doggy, you ring the bell, and the doggy just hears the bell ringing, doesn't do anything. But when you add food to it, the dog begins to associate food with the ringing of the bell, and then pretty soon all you have to do is just ring the bell, no food, and the dog begins to salivate, and its brain is anticipating the food. So it's just an example of classic conditioning. Again, the cephalic phase. The gastric phase, and then there's an intestinal phase. There's a lot we could talk about here, but we don't have the time. But there's a number of things that are going on. We're in the stomach, so we'll consider that for a moment. The food goes into the stomach, and the stomach muscle begins to mix the food, and proteases and hydrochloric acid are produced, gastric juice is produced, and it's all mixed in the stomach. There are hormones that are produced. There are feedback loops to the brain that keep this going with the nervous system, and that goes on for a while, and you have the mechanical, the mixing, and the chemical digestion with the proteases, and then that moves on ultimately into the intestines for the final phase. And the intestinal phase, along with the gastric phase, is regulated by both the nervous system and local hormones. So let's make a note of that. Let's say both of these phases. Regulated by nervous system, parasympathetic, I'll abbreviate it, and local hormones. So there's some interesting hormonal loops that, again, I'm not spending the time to go into, but I would like you to appreciate that digestion is under the control of both the nervous system and the endocrine system. So again, back to the gastric phase, then the secretion, proteases, and hydrochloric acid, we've already seen those. And in the intestinal phase, we're now breaking the large polymers down to monomers for absorption. So absorption of the monomers occurs in the intestines. There's not a lot of absorption that goes on in the stomach. Water and alcohol are absorbed through the stomach, but not a lot else. Most of the nutrients are absorbed in the intestines, small intestine in particular. Okay, So students had asked me in the past about gastric bypass surgery, so I just added a slide. I'm not going to make put a lot of emphasis on it, but I put it here because it's interesting, I think. Most of these gastric surgeries are done for patients that have severe obesity and they have been unable to lower their body weight through diet and other mechanisms, other means. So it's sort of the last resort for weight control. They are all radical, and of course the ideal situation would be where the patient could modify their lifestyle and their eating habits, exercise habits to prevent the obesity from becoming so out of control, and the necessity for doing radical surgeries like this. So one is gastric banding, where you go in surgically and you just put essentially like a little zip tie around the stomach and you just band it. And then the food coming in piles up in the fundus here and stretches, and then that feeds back to the brain, and the brain says, I'm full. So you've just essentially drastically reduced the size of the stomach. Stomach's still intact, still digest food normally, you've just constricted it. Another type of stomach surgery is reduction, where you just make the stomach smaller. So what they've done is they have sort of sectioned part of the stomach. You slice it and then you just remove part of it. And then you stitch it back together. And then the stomach is much smaller. So you've just reduced the size. Same idea, that it can then hold less food and feed back to the brain, says I'm full, and then you stop eating. Third type is the bypass surgery, probably the most radical of them all. So what happens, these are just two different figures, basically the same thing. So the esophagus coming in, here's the stomach, and they just sliced the stomach, completely chop off the fundus, the cardia region, and then they take a piece of the intestine. So this is the duodenum. And they cut it off from the jejunum, and they move so what's going on? Let's go to the lower figure. So the cut was made here and stitched back on here. So let me go back to the top. This piece with the green dot used to be connected to this piece. So they cut it and then take that and stitched it onto this top part of the stomach, made a little pouch. The rest of the stomach was sealed up, and then the duodenum is still intact, and then that flows into here. So the gastric juice that's produced in the stomach gastric juice, etc., still enters the duodenum and still enters the small intestine. But no food goes into this part, into the body of the stomach. It's just digestive enzymes, digestive juices. So that is very radical, and the life expectancy after gastric bypass surgery is much reduced. I don't know what the numbers are. But these are people that were at risk of greatly reduced life expectancy anyway. So it's sort of a last resort. So that's enough of that, and we'll start again the next lecture on the pancreas.